So, at the end of all of those bronchi, they lead down into the lungs and they get smaller and smaller and smaller. And by the way, you have thousands and millions, I would probably say. I mean, I know the exact count of the tiny bronchioles you have in your lungs, but it is a massive network. So just be aware there's a whole lot of them in there, and when they get inflamed, they can be really troublesome. At the end of the bronchioles, at the very end of that long chain that went from big pipe to smaller pipe to smaller pipe to terminal end, essentially, you have what's called the alveolus. And the plural of that is alveoli, and the combining form is alveolo. The alveoli are small clusters of grape-like sacs in the lungs where the gas exchange occurs. And when we're talking about them, we refer to them as alveolar. So you may have a condition, some sort of alveolar pathology, for instance. And just means the alveoli are having a difficult time doing that oxygen exchange. In the lungs, and we'll talk more about this in our next chapter, the cardiovascular system, you have the alveoli, and they are surrounded by capillary beds. They're very dense capillary beds that have both venous and arterial blood as they circulate around the alveoli. And this is where the oxygen exchange happens we talked about earlier in the chapter. This is where the air that you breathe in that gets trapped in the alveoli, it diffuses through a semi-permeable membrane into the capillary bed. Simultaneously, the capillary bed is releasing a molecule of carbon dioxide back into the alveoli, and that's what you're going to breathe out. So oxygen in, CO2 out. All of that exchange happens in these tiny grape-like structures called the alveoli. So we won't get into too much more detail, although as I said, in the next chapter, we're going to talk some more about this and pathologies associated with it. And it deals more with the cardiovascular system, but the alveoli play a huge role in it. But we'll get to that in the next lecture. Emia means blood condition. So it's a suffix you got early on. If you take our prefix hypo, and this is a strange configuration here. It really should say hypo and not just hype. But they're using the O from oxygen, and that's what they're joining together here. So I guess they chose to take the O off so it would fit onto oxygen. For whatever reason, we have something called hypoxemia. This is a deficiency of oxygen in the blood. It's usually a sign of respiratory impairment. It can cause cyanosis, that what I talked about earlier, the bluing of the fingertips, the bluing around the mouth that you can see, and it can lead to hypoxia. So hypoxemia is a deficiency of oxygen in the blood. Maybe you've seen a pulse ox before, those little devices we clip on your finger that measure your pulse, and they talk about the percentage of oxygen. And at sea level where we live, it's about 96 to 97% is considered to be normal. That's what we're measuring. We're measuring the amount of oxygen in the blood. Now, there is one step further. You can do a blood test that will also give you that information. And in the hospital setting, if they really needed to investigate hypoxemia, they wouldn't just use the pulse ox thing on the finger. They would go in and get a blood test, and they can do that. And they look at the oxygen levels and they report back. What they're hoping they will find as they work with a patient who has hypoxemia is that they're resolving it. They're figuring out why they have this respiratory distress. It is a potentially dangerous situation. In and of itself, it's definitely the canary in the coal mine, meaning this indicates something else is going on, and also indicates if it's not taken care of and resolved quickly, hypoxia can result. And hypoxia, its suffix is oxia, as you see above, which means oxygen. Hypoxia is a state of deficiency of oxygen in the body tissues. This is way more serious than just having low levels in the blood. Low levels in the blood indicate there's something that's constricting oxygen getting in the bloodstream. That's concerning. But when tissue starts complaining about not having oxygen, then we have a situation that's becoming more increasingly dangerous. And this is once again COVID, when the lungs can't do the oxygen exchange and the CO2 exchange. Suddenly hypoxia can result. And this is deficiency of oxygen in the tissue. This is going to lead to tissue dying. This is going to lead to eventual death for this patient if we can't get oxygen in the bloodstream. Anoxia means without oxygen. The brain itself can last around 6 to 8 minutes with a complete lack of oxygen. After that, if the patients revive, the chances of them not having permanent damage to the brain are low, although possible We have all heard the miracle stories where the kids pulled out of water after 15 minutes and there's no signs of life, and they do CPR and they come back and they're perfectly normal. That does happen. That's not usually what we associate with that type of situation. Another situation that would cause anoxia is asphyxiation. This is a hard word for me to say. Asphyxiation, or to okay, I'm just going to leave that alone. Thank you for the laughter out there. And yes, you can all throw spitballs at the screen now if you want. I can't say the word at the moment. It's a very difficult one, but you know what I mean. It means to die or to lose consciousness from a lack of air. Choking, suffocating, smothering. It's just one of those things that's very unpleasant. And if you've ever had this experience, you don't want to have it. And of course, in our recent activity that we've had with the rioting in our streets and the situations that have happened as a result of that, a lot of that has been based around the act of someone experiencing asphyxiation. Here, I said it. Good. I got it out. So it does cause anoxia, and it can cause some very serious damage to the central nervous system, specifically to the brain. If someone is anoxic and they've passed out, CPR might be one way to go. Cardiopulmonary resuscitation. So this is an emergency life-saving procedure that is done when someone's breathing or heartbeat has stopped. Many of you are probably trained in CPR. Those of you who are going to work in medicine and are not yet trained will need to have that training. What you see here in terms of how this person is positioned to give chest compressions, you'll notice those elbows are flexed. And when you do CPR, your shoulders are not going to look like that and your elbows are not going to look like that. You're going to be over on top of that patient. If you're doing it correctly, you're probably going to fracture some ribs. If you know any paramedics who ever had to do CPR on an elderly person, I've heard it described as putting all of your weight down onto a bag of potato chips. Because if you're doing CPR correctly, you're really depressing the chest to get the lungs to move. And in doing so, especially in someone who may be osteoporotic, you're probably going to break bones. It's not a pleasant thought. But if the differential is, I'm going to break a few bones and save a life, or I'm going to stand and watch this person perish, anybody who wants to live is probably going to appreciate a few broken ribs if they still have their life. So that's always on the risk benefit, but when CPR is called for, you definitely want to jump in and get busy if you're trained. And if you're not, take instructions from someone there, you might be able to help save a life. Either way, get your training in CPR, whether you work in healthcare or not, because you never know if you might need it. Now, on the other end of that, and as we all know, paramedics and EMTs have to save lives when they show up on a scene, but maybe this person doesn't want their life saved. There's situations where there's hospice, someone's dying of a long-term chronic disease, and they do not want to be resuscitated. So if they don't want CPR, they can have a DNR present, a do not resuscitate order. This is a medical order written by a doctor. It's a simple instruction to any healthcare providers that if CPR is necessary, they are not to perform it based on the patient's personal wishes. I know a few patients who had DNRs, but they didn't have them displayed correctly, and in their dying moment, they were resuscitated. And I remember one patient being very upset about this because she was at the end of her life and she was ready to go, and she was elderly and had many pathologies, and quality of life wasn't what she wanted, and she was really upset that they saved her life. But she had the DNR, and she did not display it correctly. So, just so you know, a DNR should be displayed either above the patient's bed on the wall or put it on the refrigerator. If you've ever had paramedics come into a house, and those of you who are trained know, the EMTs will go to the kitchen, to the refrigerator, to see if there's a DNR order on the refrigerator. That's one of the duties that some EMTs, I've been told, have been given specifically at sites when they've arrived. Look for the DNR, because if there's no DNR, we're going to do CPR on this patient. And so it's very important to make sure you understand clearly with your doctor that the order is signed and it's placed correctly. And of course, if you want to survive whatever episode, you do not want to have a DNR. It really kind of comes down to your physical state and how you feel about the quality of your life. If you're young and healthy and have a family, you're not going to have a DNR. You're going to say, do everything to save me. If you're elderly and chronic disease and you kind of are just tired and want to be done with it, a DNR is a great document that will facilitate you transitioning into the afterworld, whatever that might be. Okay, go back to some simple combining forms now. Get away from sort of that heavy stuff I took you down. the heavy road I just took you down a few moments ago. Pulmono is a combining form that means lung, as in pulmonary, pertaining to the lungs. I love this picture. The lung fields are often called the tree of life, and what you see in there are all the bronchioles and the tiny alveolar sacs, and this is a simplified drawing. There's way more of them than this. If you flip this thing over, it looks like a tree. You see the trunk will rise and then the branches spread out. So tree of life gets used for lots of things. I know it's a comparison that's made often, and it is relevant within the respiratory system to describe the branches of the bronchi, the bronchioles, and the alveoli. And I think it's a lovely picture. Medical specialty tied to the combining form pulmono is pulmonology. Pulmonology is the study of the lungs. It's the medical specialty that deals with diseases of the lungs and the respiratory tract. The lung disease refers to any disease or disorder in which the lungs do not correctly function. So that's kind of a given. Of course, who performs this practice? A pulmonologist. So they are specialists in the study of lungs. They're going to treat disorders and diseases of the lungs and the respiratory tract. Okay, back to some more pathology. A pulmonary embolism, PE. You've probably heard of these before. We have a lot of anticoagulant medications on the market currently where they talk about the PE that they had and they never want to have it again. A PE, or a pulmonary embolism, is a sudden blockage in a lung artery from a clot that forms usually in the leg and in the vein, and it travels and gets caught in the lungs. That's all I'm going to tell you about PEs right now. We're going to talk about them in the next chapter because they tie into other pathologies. So for right now, this is all you need to know. Just know there's something that you don't want, and it's a blood clot in the lung. And you can see that where they indicate in the drawing here, where they say damage, it's dark there, right? That is tissue that's becoming necrotic. It's tissue that's beginning to die from the result of anoxia. So in this case, the oxygen in the bloodstream is not getting there. So once again, oxygen, very, very vital to the health and to the continuing survival of the human species, as well as most mammals, as well as most life, to be honest. Pulmonary function test. We're going to tie pulmono in on that. We'll finish this slide, and then we'll have a few more for you in the next series. A pulmonary function test, abbreviated PFT, is a test to determine the ability of the lungs to exchange oxygen, O2, and carbon dioxide, CO2, efficiently. So PFTs cover a broad range. We're going to talk about something a little bit later on called a spirometry, and that's part of a PFT. Maybe some of you have had lung disease and you've had to use a device that you blow in that you get from the pharmacy that shows what your vital lung capacity is. So any one of those. It's very simple or very complex tests that may involve a simple mechanical device or a complex computer program. Could be PFTs. If they're measuring the ability of the lungs to exchange CT and CO and CO2 efficiently, it is a PFT. All right, I'm going to pause it for a moment. Be back with you in just a few moments.